In this cardiovascular lab, we're going to look at the major arteries and veins using this 3B model. Okay, we'll start at the heart. The heart is going to have four chambers. We have the right atrium, the right ventricle, and then blood will go through the pulmonary valve into the pulmonary trunk into the pulmonary artery. And this is the left pulmonary artery, and this, and it would go all the way over here, would be the right pulmonary artery. And I know what you're thinking. Wait a second, I thought arteries were red and veins were blue. Forget that. Okay, this is a little bit different when we're talking about the heart. Remember that arteries go away from the heart, veins go toward the heart. Okay, so arteries go away from the heart, veins go toward the heart. And a couple of exceptions where we're going to see different colors would be, again, with the heart, it's showing it blue because that's representing unoxygenated blood, and it has to go away from the heart to get to the lungs to get oxygen. Okay? And so after it picks up oxygen, it's going to come back to the heart. Remember what goes toward the heart? Veins. And so these red vessels in the lungs are veins, pulmonary veins. Okay? So again, we have the pulmonary arteries in blue, pulmonary veins in red. I said there's another example, and that would be in the umbilical cord. Again, the vein is going to be red and the artery is going to be blue. And so once again here, the blood from the pulmonary veins will dump into the left atrium. From the left atrium, it will then go into the left ventricle. So left atrium to the left ventricle, through the aortic valve, and then up through the ascending aorta, the aortic arch, and then the descending aorta or thoracic aorta, which is kind of difficult to see on this model. So let's take a look at this model here. You can see the descending or thoracic aorta going through this area called the mediastinum. Okay, before it makes its way through the diaphragm, and we'll discuss that in a little bit. Okay, and so some branches coming off of the aorta. The first two branches, and it doesn't show that in this model, but they're going to be the coronary arteries. So you'll have your right and your left coronary artery. And then so one of the first major branches coming off is going to be the brachiocephalic artery. Okay, brachiocephalic artery. Now, this is important to know that there is one brachiocephalic artery. There are two brachiocephalic veins, and again, I have a better model to show you that, but only one brachiocephalic artery. From that is going to branch off the right common carotid and the right subclavian artery. Okay, so the right common carotid artery and the right subclavian artery. The next branch to come off of the aortic arch is going to be the left common carotid artery. Okay, and then that'll split into the external carotid. You can't see the split for the internal carotid, but this would be the external carotid. And then the third branch here is going to be the left subclavian artery. Okay, so let's see what happens with the subclavian. Subclavian, just like in the name, it's going underneath the clavicle. When it comes out around the armpit, of course, armpit area is what? It's axillary. So this will be the axillary artery. Okay, and then as we move down, okay, again, here's the right and the left subclavian artery. Then our axillary artery Then our brachial artery, because remember your upper arm is brachium, so that's the brachial artery. You can see that here too. And then we're going to split into the radial artery on the thumb side and the ulnar artery on the little finger side. And again, as we go down a little bit farther, radial artery, ulnar artery are going to then form the superficial palmar arch. These do connect, by the way, but the superficial palmar arch. And then we have some digital branches here. So let's take a look at some of the major veins then. Here we have the superior vena cava, which empties again into the right atrium. And connecting to this is going to be, and it doesn't really show it very well here, so here's another model that shows it just a bit better. Again, superior vena cava. And then we have the left and the right brachiocephalic veins. Okay, so right brachiocephalic vein, left brachiocephalic vein. Again, remember, 2 brachiocephalic veins, 1 brachiocephalic artery. And emptying into those are going to be the internal jugular veins. Also emptying into those from the arms are going to be the subclavian veins. Okay, subclavian veins. And so this, once again, on this model would be the left internal jugular vein, the right internal jugular vein, the left brachiocephalic vein, and kind of the right brachiocephalic vein, and then the subclavian veins. Now moving down the arm a bit, again this is the subclavian vein. You're going to have this vein at the top here, and this is the cephalic vein. This one on the bottom is going to be the basilic vein. And then again, we have the cephalic vein, the basilic vein. Coming down here, this is going to be the median antebrachial vein. Again, the median antebrachial vein. And moving back to the abdomen, again, I mentioned that the descending or thoracic aorta will poke through the diaphragm and then become the abdominal aorta. So this is the abdominal aorta. And let's move in a little bit closer here. And here we're going to have what's called the celiac trunk. The celiac trunk. Branching off of that is going to be the left gastric artery. It's not labeled on this one, but it's the left gastric artery, the splenic artery, and the common hepatic artery. And these are going to be hepatic arteries right here. This is the common hepatic artery. And moving down, we're going to have the superior mesenteric artery. If we have a superior mesenteric artery, what else do you think we might have? That's right, an inferior mesenteric artery. So this is the inferior mesenteric artery. Okay, going back up, we have the left and right renal arteries. Okay, left and right renal arteries. And then we branch into the common iliac arteries. Okay, looking at the veins, we have the inferior vena cava. Okay, inferior vena cava. And we have the right renal vein and the left renal vein. And just as we had a splenic artery, we have a splenic vein. And right here is going to be the hepatic veins, which is going to drain from the liver into the inferior vena cava. And moving down, we have the common iliac veins. And so taking a look at the iliac arteries and veins, we have the common iliac artery and the common iliac veins. Then we're going to have the internal iliac artery and internal iliac vein, and then the external iliac artery and exterior iliac vein. Now, once that artery and vein go under the inguinal ligament that goes from the ASIS, the anterior superior iliac spine, to the pubis, right like this, then it's going to become the femoral artery. Okay, so now this is the femoral artery. If we look here, this tiny little branch here that's been cut, of course it's going to be much larger. So this will become the femoral vein. So one more time, we have the common iliac arteries, common iliac vein, internal iliac artery, internal iliac vein, external iliac artery, external iliac vein. Once it goes under the inguinal ligament, it becomes the femoral artery. And this little nub would be the femoral vein. Now, as we go down the leg, behind the knee, so this is the femoral artery again, behind the knee is the popliteal artery, or popliteal, however you'd like to pronounce it. And this large vein right here, and again, let's go back up here. So this large vein is going to be the great saphenous vein. So great saphenous vein. And then moving a little farther down the leg here, again, here's the popliteal artery, or popliteal, however you'd like to pronounce it. How you can remember that is if you bend and your knees pop. That's how you can remember this is the popliteal artery. Okay, and it's right behind the knee in what we call the popliteal fossa or popliteal fossa. Okay. And right here, going behind the leg, is going to be the posterior tibial artery. Okay, posterior tibial artery. And this is your tibia. And this coming anteriorly, of course, is going to be the anterior tibial artery. Now, looking at the top of the foot, in this area here, is going to be the dorsal pedal artery. So, again, the dorsal pedal artery. And just going a little closer again, we can see the dorsal pedal artery. And the reason this is important is because this is a common pulse site when you want to check someone's pulse going to their lower extremities, especially when you're checking on like diabetic patients, for instance.